Hello, everyone, and welcome to CE Institute. My name is Selena Belisle, and I am the founder of the school, and I'm also one of the sports massage instructors here as well. For those of you who do not know me, I am a three-time WAF World Arm Wrestling Champion. I won my first world title in 1989 in Athens, Greece, where I was first exposed to sports massage techniques that the athletes were practicing on one another. And I have loved massage ever since. Now, I went on to become a Paul St. John neuromuscular therapist after I completed rudimentary massage therapy training. I took over a 1,000-hour training at the Massage Institute of New England in Cambridge, Massachusetts, to become a licensed massage therapist. You should not be practicing massage unless you completed massage therapy education and you have a license to practice healthcare. Right now, what I'm going to show you is a technique that I did learn in Paul St. John neuromuscular therapy. They called it the cervical snake technique. And this is something that's a little bit more advanced. We're working around the spinous and transverse process of the cervical spine. You need to be aware of where those bony prominences are, and you will learn that in your anatomy class in massage school. So you need to have basic knowledge of anatomy and physiology and pathology and more to be able to practice massage. Now, in this technique, I'm going to be practicing as part of our sports massage training. And you'll see that I'm on a massage table that has a shower curtain on it. Before I show you the technique, I'm going to show you really quickly on our website at ceinstitute.com. We have free training available. And if you select your category, there's many different free trainings that we do have. If you click on sports massage, you'll be able to see that we have additional techniques here of different things you can practice for your athletes if you are working in sports massage. Okay. You can also subscribe to our YouTube station. We have many other videos here above and beyond what I am about to show you. This is usually reference material for students who have already completed our training, but we welcome all to watch and learn. Let's begin. So with the cervical snake technique, the head goes kind of anteriorly, posteriorly, inferiorly, and superiorly. It's like this roundabout snake, as if a snake is coiling back and forth. And we're making like a V between our thumb and our pointer and middle finger. And the spinous process are going to go in between that V of the thumb and the pointer. We pick up the client's head, we insert our fingers, and then we lower the client's head on top of our fingers. I just changed fingers here so that, I'm not tiring myself out. And that is how it is practiced. You probably wouldn't spend more than 30 to 45 seconds practicing that cervical snake. I'll play it over here for you again. We usually turn the head to one side to get our hand underneath and then the other as we place it. And again, I'm doing this in rapid succession. This is professional licensed practice right here. When you're learning this, you'll probably go a lot slower. And it's really nice for people who have been standing upright and maybe had their neck frozen for a while, whether they're jogging in a marathon or, anybody who's having any type of cervical issues. Maybe they have headaches. Any type of soft tissue where compromised area where they want to increase circulation, reduce pain, maybe increase range of motion. And when we get those stiff military type necks, anytime you can get the joints moving, that creates freedom, painless moving. Sometimes people are guarding and not moving their necks because they're so used to pain when they do have that movement. So if you can do like sports massage techniques right here, especially with athletes, where you can have this rapid succession of passive joint movement and they realize, oh, wow, that doesn't hurt. Maybe I should start moving my neck. Hopefully that will restore motion, function, and strength for your athletes.